Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
And this morning, he's focusing on the trends behind opioid prescriptions.
Yeah, this was a huge topic for about 20 years, actually starting about 1996 and then kind of continuing on. So I saw an update on a new study coming through and felt like it was a good time for an update to give the public where we are with the opioid epidemic. So we're going to dive right into this news study. A new study published in JAMA Network Open shows how opioid prescribing has changed dramatically over the last 15 years. Researchers analyzed more than 110 million opioid prescriptions from nearly 15 million patients between 2010 and 2024. The biggest finding? Overall opioid prescribing has declined substantially. That's good news, especially for long-term use, while pain management specialists are writing a larger share of these prescriptions that remain. Primary care physicians still prescribe the largest number of opioids, but their share has steadily decreased as more patients with chronic pain are being managed by pain management specialists. Researchers also found that opioid doses have fallen significantly over time, reflecting ongoing efforts to reduce the risks of addiction, overdose, and other complications. The findings suggest that prescribing has become more targeted, with specialists caring for patients who have more complex long-term pain conditions. However, the authors caution that reducing opioid prescriptions is only part of the solution. Patients with chronic pain also need to access effective alternatives, including physical therapy, behavioral health support, interventional pain treatments, and other non-opioid therapies, particularly in rural and underserved communities. So the key here is that we're making the right strides. Just like any other medical condition, we find the specialist to treat that specialist problem. Chronic pain requires a multidisciplinary team that can help manage that safely and do the right options for each person, individual, to their pain complaint.
You have a family member who's been dealing with some pain and trying to manage that.
Well, I was just saying my grandmother just got a knee replacement, so they gave her Oxy, and she just finished it. But she said it was a great help right after she got the surgery when she was first recovering.
So it depends, yeah, that's it. So the acute pain management, that's actually what most of them are designed for. The opioids really were for acute post-operative pain or in cancer pain. And so they really expanded that from 1996 until about 2015 or so, and then started to drop off once we discovered the harms they were causing. So it really is finding the right medicines for the right patients in the right situations, and otherwise finding other things that people can use to help with their pain long term.
Quick answer, next topic when we see it.
Next topic, yes, we're going to talk explosive diarrhea. I know everybody's excited about that, so get ready. Your breakfast may need to be put down. We're going to talk about the cyclosporosis and actually the things that you can do to help protect yourself and your family.
Sorry I asked.
Yeah, you should be.